You're listening to a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 20 years, please visit www.aapcho.org.
In commemoration of National Health Center Week 2010, AAPCHO brings you this special edition of Voices from the Frontline, Innovations in Workforce Development. Voices from the Frontline is a podcast series dedicated to spotlighting the unique experiences and insights of the dedicated, passionate people at the helm of AAPCHO's member health organizations. In this episode, Communications Assistant Beverly Quintana talks with Rich Bettini, CEO of Waianae Coast Comprehensive Health Center, about Waianae's workforce development program and his thoughts about the patient-centered medical home.
So we have Rich today to get his insights on the importance of workforce development and patient-centered medical homes. Rich, if you wouldn't mind, can you tell us briefly about WCCHC's workforce development program?
Well, actually, we see a real connection between the medical home and workforce development. The medical home means something different to different communities. And I think in a low-income community, often the community health center may be the largest employer. So for our health center, we've connected for years that if you want to improve the health outcomes in your community, you've got to create jobs for people. So, we do that at all levels. We have a health academy that trains entry-level workers to get jobs in healthcare. We have a program for on-the-job training that gives college credit for core competencies, and we are linked with several professional schools so that our residents, our patients, and our workers can move on to professional school when they're ready. So, it's workforce development is a key topic right now, and it is directly linked to a advanced healthcare home.
Why did you consider it important to develop a formal program?
Well, we weren't that bright at first, actually. You learn to do things by making mistakes, and initially we needed to meet our own needs, but it's evolved into that now. We formed a health academy. Like I say, initially we did it ourselves. Then we found a reason to partner with the community colleges. So we have an interagency agreement with 3 community colleges. And that converted our simple courses into really a continuum of college credit courses. And through hit and miss and experience and seeing, what works, we now have a fully accredited health academy. And we're looking at other opportunities now in terms of expanding professional education. We're really our mission is about improving the health of the whole community, and there is a link to people having a job, being able to make payroll, and family stress. And family stress equates to disease. So, there's the epidemiological model. But it's also easier and better to retain employees that have a long-term commitment to our mission, to our community. And these are the employees that tend to stay for 25 years. And they're the most dedicated, hardworking employees. They also understand what we're about, understand that we're about helping our people and helping our community. So if you can get someone with that motivation and that orientation employed as long-term employees, you're way ahead of the game.
Thank you. I also wanted to ask you what your thoughts were on the healthcare home, the concept of the healthcare home. Could you tell us about how you think community health centers fit into this concept?
This is very important because whether it's called the healthcare home or pay for performance or accountable care, we're about to go through a paradigm shift in healthcare. And the electronic health record is going to provide more intelligence to those payers that divide up the risk pool funds for healthcare. Instead of relying on claims data, which is what's driving the healthcare system right now. It's insurance companies looking at medical claims and allocating resources accordingly. Well, now we're going to have firsthand or direct access to diagnostic and treatment data, which is going to mean that it's going to empower decision makers to pay for value. And so we're tracking this because we're very concerned that the value that is rewarded, whether it be in performance outcome or capabilities of medical organizations, it's very important that they recognize the value that community health centers bring to the table. For example, in a low-income community or when serving a special population group, we have found that there's real value in things like transportation, translation, cultural proficiency, that these things count as much in a clinical outcome as prescribing the right medication. So as we look at what metrics will be used and what capabilities organization will be rated at or scored at, it's extremely important that we look at population characteristics, how they can be addressed, and the kind of services that health centers provide.
This podcast was brought to you by AAPCHO. Please join the conversation on our Facebook fan page at facebook.appcho.org and tune in for our next podcast at www.aapcho.org.